Okay, so my patient is a 56-year-old man who comes in with his wife seeking care because he's had chest pain off and on for 1 month and it's getting worse. That's why he came in today. His HPI is that his chest pain is on the left side, radiating to the left shoulder. He describes it as a heaviness, and like I said, it's gotten worse. The numeric value is 7 out of 10 today. It's relieved by rest and sleep, worsening with activity, and he also developed some shorter breath when he's walking. And in fact, he has not been able to do his normal activities, although he has been going to work. Past medical history, he hasn't been to a doctor for years. He denies any past medical diagnoses, does not take any medication, and has no allergies. He does have a 45 year smoking history, and he is obese, has a high BMI. I don't know what the BMI is. Review of review of systems, negative for negative skin, negative musculoskeletal, negative psych history, negative respiratory, cardiac system, is positive for the dyspnea on exertion, and is not aware of ever having an EKG. No history, known history of hypertension. GI system is negative except for a little bit of decreased appetite because he's worried about what's going on with him. But no weight loss. Blood pressure is up today, and I don't know if that's due to anxiety or if that's a baseline. Physical exam, positive for an S4 Gallic, positive for a right femoral buoy and trace edema. Family history, I have this out of order, I wish I would have done that before. Family history, father and male sibling, both with history of heart attack. Father has history of hypertension and high cholesterol and obesity. Mother is healthy. The most likely diagnosis is angina. Can't afford to miss is if he's having an acute MI right now. And then two other likely diagnoses would be
what's your can't afford to miss?
some kind of coronary insufficiency
Can't afford to miss.
some other kind of cardiac.
You've heard lung sounds.
But can't afford to miss an acute MI is supposed to could have it already. So those would be my other two. And what I'm going to do with him today while he's here is get him EKG and do cardiac enzymes and do all that workup. I don't know if an echo is appropriate or not because I need to decide whether or not he has to be hospitalized or whether if it's simple angina, if we can just treat him with glycerin. So I don't really know anything about cardiac, but I feel like that I have to get some data before I can decide if we can even go home and stay. So that would be the EKG, maybe the echo, cardiac enzymes. Medications would be nitroglycerin, sublingual, maybe some morphine while we're getting the workup completed, and then find out where we're at and maybe appropriate to start him on an ACE inhibitor. We can take his blood pressure a few more times on this year and get more of a sense of hypertension. And depending on the findings today, then we'll have to decide the follow-up before I can really address that until I get more information.